Hello and welcome to Period Proud. I am Dr. Nadira Rambokas of Crowner TT, and we are committed to providing adequate period education. Today, we have a special guest with us, Dr. Sherene Kalloo, a consultant obstetrician and gynecologist at St. Augustine Private Hospital, and she's here today to enlighten us about the female reproductive system. Welcome, Dr. Kalloo.
Thank you. Thank you for having me.
Let's dive straight into the female reproductive system. There's an outer, external female reproductive parts, and there are internal female reproductive parts. Could you explain the outer female reproductive parts?
Sure. So I worked with my own model. However, I couldn't work with the external genitalia, so this would be the internal genitalia. We're going to be talking about the external genitalia, first of all, which to the naked eye, to the young girl who is looking at herself. And we do encourage you to take a mirror to look at yourself so you can understand the normal anatomy and what you're supposed to be seeing, so you know what abnormal is. So first of all, you will see what we call the labia majora. And the labia majora is the outer folds of skin that would protect the inner genitalia, so the inner structures. The next part that you would meet, so this would be external, this would be on the outside. This is the vagina, so we didn't reach here yet. We're still external. Just inside of that, you would meet up the labia minora, which is the inner fold, which is located within the labia majora, and it surrounds the vaginal and the urethral openings. So all of this is protective for the female. Then you would meet the vaginal opening, which would be the next structure, which would be right here. Now, the urethral opening, first of all, is the opening through which urine would be passed. And the urethral opening would be one of the three openings that women have very close together down there. Right. You have the urethra, the vagina, and then the anus. Right. And that's part of the reasons that women are more likely to get infections, because of these three openings close together. Right. But they are, the urethral and the vagina are protected, and once you continue with your habits, which would mean cleaning yourself properly, you shouldn't have a problem, which you will have another guest speak about, I'm sure. Then we get to the vaginal opening, which is here, which is this structure here. So the vagina would be different sizes, different lengths in different women, and this would be the entrance to which blood will then exit, which is what we're here to speak about, the menstrual flow and the menstrual cycle. And also, the babies are delivered via the vagina and out the vaginal canal when we have a normal vaginal birth. Before we get into the vagina and continue upwards, there is what we call the mons pubis, which is the area external, which is the soft, fatty area above the pubic bone. So this is external as well. And this is what is covered with the pubic hair, which young girls would see. The first thing that happens with puberty would be breast buds, and then the hair growth. So we'll see the hair growth in the pubic area, under the arms, etc. And this is the area where so the mons pubis is a soft, fatty tissue that is above the vaginal area and above the labia majora. We spoke about the anus, where we could mention that's external as well, which is the anus. That's where the stool comes from, and that is behind the vagina. So that is what we call posterior to the vagina, and that is where the stool would be exited.
Right. So now that we spoke about the external reproductive system, let's talk about the internal. What goes on the inside?
Right. So obviously internal, we can use a model to demonstrate this now. And if we look at the anatomy, this here is the vagina, which we just spoke about, which is where you would have the period, the menstrual period coming out of. Then there's the cervix, which is the mouth of the womb. Then there's the womb, or the uterus. And then there are the tubes. We have two tubes, and we have two ovaries on each side. This is a normal anatomy. So let's talk about the ovaries. Let's start from up here and speak about the ovaries, and then we work our way down. So the egg production and egg growth and maturation would be in the ovary. So the eggs, we call them the ova, and they mature each month. So each month, with regular cycles and regular hormones, you will have the maturation of the follicle, and then it's released, what we refer to as ovulation. So it reaches to the periphery and it is released. Now, this process, which is called ovulation, is related to your hormone production and the secretion of the hormones, which would be estrogen, progesterone, and these hormones would regulate the menstrual cycle. There's a lot more in-depth because it comes from the hypothalamus, pituitary, ovary, etc., and the endocrine system. But just to keep it very basic, this is what the ovary does and the secretion of the hormones. So we move on now from the ovaries to the fallopian tubes. And the fallopian tube is this structure here where the ovulation process and egg production will, when that releases, it passes, the function of the tube is for the passage of the egg or the ovum. And this will go and pass, not quite to the uterus, because what happens when sexual intercourse takes place, the sperm would be deposited in the vagina, and then they would track up through the uterus, and it would meet here in the tube. So that's another function of the tube. The meeting of the egg and the sperm would be in the tube, and then the fertilized egg and sperm is going to move down through the tube back into the womb, into the uterus, and implant into the womb. Now, if we have a virgin and somebody who's not sexually active, this ovum that's released here is going to pass through the tube and into the uterus, and then it passes out. It's not something you can see, it's not visible. So if it's not fertilized, we're now talking about a menstrual cycle is going to happen because it is not interpreted as a pregnancy taking place. So with all the hormonal release that happens with the body, what happens is the lining of the womb, which is what we call the endometrium, is then broken down. And that is released as what we call menstruation or a period, and that's how your cycle will begin. And that, of course, can vary with the amount of days that different people would have. The other function of the womb is that, of course, if a pregnancy takes place, then a fetus is going to grow, and you have growth and development of a baby. And, of course, the uterus will then aid in contracting and pushing that fetus out, that baby out, for delivery at the time of delivery. The other body part here in this that we said we were going backwards with, we started here. So this is from internal, the cervix, very important part of the uterus. So this is what they refer to as the neck of the uterus. This is a connection point. And this here is the lower point of the uterus, as we said. And it opens into the vagina. So the function of the cervix here would be production of mucus. So we do get a little bit of a discharge, which is absolutely normal in most women. And also it is the connection for the birth canal for delivery. So this is what dilates during labor for a woman to have a normal delivery and birth. And of course, this is where the blood passes through when you have a menstrual cycle. So it comes out from here, through the cervix, through the vagina, and externally through the body.
Great. So thank you, Dr. Kalloo, for being here, for being educational and informative. I am Dr. Nadira Rambukas as we continue our Period Proud education series so that all women can participate in their daily lives with dignity.